But then there's the whole, it's not just that, it's also like lack of control. It's like, I should be able to figure it out on my own. I don't want to go on antidepressants. And you know what? Sometimes it's okay to go on antidepressants, especially if you have some huge traumatic experience. And some people undermine their experiences like, oh, well, I should be able to conquer it by yourself. But here's the thing, guys. So Tanya, you and I have been talking, and here's the thing. We're always looking at, you know, wanting to do things all natural, but the reality is there's a time and place for everything, which may include pharmacological drugs at some point, right? I know growing up and literally like my whole life, I think I can count it on one hand how many times I've taken an aspirin.
Right. Yes. Well, for you, I was the same up until recently. Crazy. I've been using naproxen twice a day. Isn't that fascinating?
Well, and so I think that's why we're getting on here. We're doing like a total uncut, completely off the cuff hat because Tanya and I were offline speaking to this. And I just think that let's be honest and be real. And like, yes, I know we're like into natural health and all that stuff. But, you know, sometimes we're faced with things in life that we cannot control. And, you know, you were like gung-ho. Actually, I'll let you speak to your story if that's okay.
So I was all excited about spring cleaning and I was organizing and I was packing up the house, and I'm a powerhouse. I'm really strong and I like to use my body for cleaning and thinking about it as a workout. But I overdid it and I don't have an off button sometimes. And so I packed up every closet and organized. But as I was doing that, I injured my hands, and my mother has osteoarthritis. And I created an osteoarthritic flare, and then I fell on my bike and then I overdid it. So I was like, okay, time to slow down. And I realized like when I literally couldn't even get to the point of typing, I had to get a new mouse that's ergonomic, a new keyboard. I got wrist guards and to just recognize, like I tell my patients, you don't have to be a hero. I took my own advice. I slowed down and I took a week off and rested my hands. But then I also took anti-inflammatories just to slow the inflammation cascade down. So it's really important to recognize that although obviously I'm going to be my backup and my long-term plan would be something like curcumin, the turmeric, glucosamine and MSM, to get out of this flare, I was like, I got to do everything I can. So naproxen or ibuprofen twice a day, and it's helping. It's a slow go because I really damaged my hands. And so I want to just go back and say, so you're actually utilizing the best of both worlds, right? Yes.
So, and listening to yourself. So yes, I'm going to stop. And now I'm actually going to take care of myself and heal, looking at the supplements that I'm utilizing, which is more natural. But also it's okay to go there and take the naproxen in this moment, because I know your goal is not to actually be on it for life, right?
And I can count on my hands the number of times that I've taken, these medications. But I always say to my patients, like, if you have an injury, if I'd have had injuries in the past, my mother would, just do the RICE, like, rest, ice, compression, elevation. I wouldn't take Advil or ibuprofen, but as a seasoned athlete and then a more mature woman, I will take an Advil, knowing that if I don't, take it, if I've injured myself, the inflammatory cascade can sometimes get away with itself and cause more damage.
Yes, that's right.
Yeah.
And this brings to mind yesterday, and my daughter, we were playing outside and she was having a grass reaction, but it's not just the grass. Like she has a tendency towards eczema. She has sensitive skin. So she was like touching her arms, and like we were outside for 2 hours. And when she came back in, all of a sudden she's like, Mama, I'm itchy. And it was like giant puffy things on her arms. Hives. It was hive-like, right? So it's like, okay, I could be the old naturalist and just like deal with it completely naturally and let her completely suffer. Or in that moment, I'm like, you know what? We have some kids Benadryl. I'm just going to give that to you right now so that you can have a bit more comfort. And guess what? I'm even going to use some hydrocortisone on it right now because you're like dying of itch. Yeah. And then simultaneously, like while she, then soothed herself very quickly, I actually, at the same time, I'm like, let's cool your body temperature down. So that's when I added in, like, I actually put her feet into like a cool tub of water, soaked her feet to cool her down. And so again, the combination of the East meets West, like, it did the trick. And I know that this is not what we're going to do all the time.
No. Right. Because of the side effects. Like if you are on ibuprofen long-term, you can get gastritis and stomach ulcers. If you're on antihistamines, it can cause nutrient deficiencies. It can also dry you out all the time. So there's side effects, right, to taking medications long-term. So we're not about long-term medications, but short-term, acutely, medications are powerful and they work, and we don't have to be a hero. We don't have to suffer, and it's okay. And oftentimes patients do come in and say, I absolutely, I'm diabetic and I don't want to take metformin, and I want to bring my blood sugars down. And sometimes I will say, as another example, I'll say, okay, look, we need to get your blood sugars down so that you can feel good. And why not do the combination? And then potentially you're then getting off of the medication
that
your doctor has prescribed with the doctor. So, it's a matter of doing like integrative medicine, not alternative. I've never liked the name alternative because we can all work together.
Yes. And you bring a great point too. So to reiterate, really where the Western medicine comes in, and it's really excellent at doing things, is in an acute inflammatory state. Right. Yes. And then beyond that, actually, like for a chronic stage, it's oftentimes they fail at it. Right.
Yeah.
So this is where things, that's where we come in. So the whole point of this exercise is it's okay during the flares if you need to go to something. And then after that, like definitely do your due diligence in terms of your lifestyle and like, how active or how inactive you should be, how or not overactive. And then, in what you eat and in even the normal supplements that you may take or would like to take and just for the long term to keep you from going into these kinds of flares, and then reevaluating your life. And actually, instead of every time you're gung ho, it's like, oh, wait, I've been here before. And maybe I don't need to like be excessively cleaning for 12 hours straight. Life lessons in here.
I know, right? Learn your turn off. So that you don't get turned off.
Exactly.
Pain. Yes. So it's recognizing that you have limitations. Absolutely. Even limitations with anxiety. Like I've had patients who are just anti medication generally, but they've got anxiety and perhaps they have been prescribed an Ativan, but then they have these panic attacks. And so what I've been teaching patients is that obviously you always want to look at the 4 pillars. So looking at like, are you moving to use up cortisol, and are you sleeping enough, and looking at where's the anxiety, what's the source, and get counseling around it. But if you have continuous panic attacks, number 1, it's exhausting. Number 2, you have the memory of the panic attack, and then you're anxious about even getting a panic attack. So even if you hold a little Ativan or benzodiazepine, what we call an anxiolytic or something that brings down anxiety, if you would just even keep it in your purse or, just as a Band-Aid treatment, knowing that it's there, all of a sudden it's like, I know I have that treatment just in case. And then the anxiety goes down. So recognizing, and then if you do get it, that it's okay. It's been prescribed. You can take it. It's safe. It'll bring you to normal. And then you got to reevaluate, how can I get to this place where I don't need it? So it's okay to use the 2. And then there are, of course, herbs that are very effective to help bring down anxiety too.
And
as the active, exactly. And treatments, right? That you can use in all together to reduce the likelihood and the intensity of the anxiety and panic attacks. But it's okay to have the Band-Aid treatments. And we just want you to know you don't have to be a hero, and that it is very effective and safe when used in very low doses and properly. So it's just important.
Yeah. And again, and we're not saying, oh, gee, like just turn to it and that's it. We are actually talking integration. And then so it's like a learning lesson. And then from that, you go back to, okay, what else can I do to help myself so that I don't necessarily have to jump to meds when I need it? And hopefully you don't ever get to that place, actually.
No, right.
But so it's like, and the Tao and Chinese medicine, the whole premise is we're working on prevention. So if you're in that moment of, there's activation and your adrenals are going crazy, you're not in a preventative mode, right? We're treating what is necessary in that moment. And then we can work on prevention.
Yes. I think the fear is the side effects. We know that anxiolytics, as an example, are very addictive. And and then the doses go up, and then it's really hard to come off of them. But taking 1 or 2, if you're having a panic attack, to stop the memory of that panic and the exhaustion that comes along with it, it's okay. So that then you can do all the preventative medicine like you're suggesting. So it's the fear of the side effects, I think, often.
Right. There's fear of side effects and the fear of addiction.
Yes.
And then, but then there's the whole, it's not just that, it's also like lack of control. It's like, I should be able to figure it out on my own. I don't want to go on antidepressants. And you know what? Sometimes it's okay to go on antidepressants, especially if you have some huge traumatic experience. And some people undermine their experiences like, oh, well, I should be able to conquer it by yourself. But here's the thing, guys. What I see is like life, and we are actually mammals, and we are a communicative species. We're not meant to be isolated and alone, and we're in an isolated and alone place right now in the pandemic times. So it's like, how do we call on our community and let that be part of our medicine? But simultaneously, it's okay if, let's say, I'm just going to make it up. Like my mother passed away, my dog passed away, and, all within 3 months. And then my brother had COVID and I have fear about that. It's like, bam, things piling up on another. And of course, yes, they layer. So of course that can cause this huge shift in how your mind and body is functioning. And so sometimes it's okay it's like, oh my God, I'm so overwhelmed. I just need something right now.
Yes.
And then once
if the natural doesn't work,
right.
Then the medication.
Yes.
Right.
Yes. Cause but Mary, I've been meditating, or I've been, doing all those natural things. It's like, yeah, of course, do all of them for sure.
And then get help, like, do the talk therapy and get supplements that might help with serotonin boosting. And then of course, medication if you need it. Because then you can actually get proper counseling. Sometimes you're just so frozen, you can't even communicate your feelings, like you were saying, that sometimes you just need the medication just to help you be able to communicate about how you're feeling.
Yeah, exactly.
Otherwise, you might be a continuous, crying mess because you're having a hard time processing everything, can't get out of bed in the morning. It's definitely... it's great if you can process your emotions. Some people don't like the idea that medications will numb them, but if you can be numb for a very short period just to be able to get through it and then wean off of it, but while you're on it, change the lifestyle so that when you come off of it, you're actually able to get through traumatic events more easily. But like you're saying, it could be just so many layers that has nothing to do with your lifestyle even. And then again, don't be a hero. You don't need to be a hero. At the end of the day, we need to be able to show up for ourselves and everybody else around us and enjoy the experience of life, right? Otherwise, what is life, right?
Yeah.
So
I think we got our point across, right? So,
I think so.
And I don't think we're coming across as though we are like big proponents and saying, oh, just it's easy, just turn to drugs. Like we're totally not part of that conversation. Like seriously, right?
Yeah, no. I can give another example.
Okay.
So fevers, because since, COVID is prominent right now, there is research and people discussing that fever isn't really going to do a heck of a lot for COVID because of the origin of where it came from. But in general, it's a part of our immune defense. So, with flus and colds and such, do we want to treat every fever? Do we want to just say, okay, our kids have a fever, or we have a fever in response to a virus? Do we want to just suppress it with Tylenol or ibuprofen or acetaminophen or ibuprofen? Generally, no, but we're almost afraid of fevers as a society. But it's the way that our immune system kind of brings in the army of defense, like our little white blood cells. And it attacks, it helps to heat up and kill the virus. So it's actually helpful if you leave it, as long as you're comfortable, because really you're treating the human. You're just checking in with the human. Okay, you've got a fever. And we want to see, like, are you really uncomfortable? Can you sleep? If you can sleep through a fever and you don't have a risk for seizures or any other complications associated with fevers, and you would know that from your history of having fevers, then see if you can just sit comfortably. And really, if you're in pain and you're uncomfortable, that's when you're using ibuprofen or acetaminophen. You're not actually trying to squash a fever. Does that make sense?
It totally makes sense, because I always think of, your army of soldiers of defense mechanism is there. And then it's like you have the heat to rise so that it literally helps to kill. Like, it's our natural healing mechanism. The fever is there with a purpose. It wants to drive out all the virus, bacteria, and at a certain temperature, it's going to help your body do this more effectively. Right. But however, having said that, then what do you do when the person has prolonged fever, high fever? Then okay, go ahead.
So yeah, you would just do tepid baths and cool cloths. But again, you're treating their comfort level. So if they can handle the fever during the day and just rest and, distract themselves, watch TV or whatever. And then during the night, if they can't sleep is so important. So in that case, I would treat the fever at nighttime to allow them to sleep. And if you have children, then that's what I'm referring to. Treat the fever so that your children can sleep, so you can sleep, so you're not getting the virus or whatever that they're getting just by lack of sleep. So it's like treating comfort, and sleep is like huge in the recovery process. So you don't want to squash that.
That's a really great example. So thank you for sharing that. And because of this, in light of this, we just need to also have our disclaimer in place. This is not medical advice. This is what we experience and what we see. So really, if you're experiencing any of this, you go to your health practitioner and you seek their advice, right? Yes, and if it happens to be Tanya or myself, then of course we can tell you what we need to tell you.
Yes, give you direct advice. Absolutely, 100%.
So I think, is there anything else you want to say? Did we miss anything? Like, how about the metformin? Did we talk about metformin?
So we didn't talk about metformin. Well, we did mention metformin, but we didn't talk about, like, patients kind of are, if they show up with diabetes and they're a little resistant to go on medications. And in some cases I say, actually, your doctor and I have both agree that we don't really need at this point. Lifestyle changes might be okay. But if you really need the support, it's okay. And I guess what we didn't mention was, side effects of metformin could be vitamin B12 deficiency. We didn't talk about the deficiency it can be associated with taking these medications or the side effects. We did talk about some of the side effects, but with metformin, it could be a vitamin B12 deficiency. With anxiolytics, it could cause like cognitive issues later on in life, like memory loss if you're taking them. If it's chronic long-term use of Tylenol or acetaminophen, it uses up your N-acetylcysteine in your body, which is really important antioxidant that helps you generate glutathione to bind and eliminate waste from your body. So actually, if you show up to the emergency room overdosed on acetaminophen, they'll give you N-acetylcysteine through IV. And we'll use N-acetylcysteine for liver support and egg quality and thyroid support. So it's just interesting how some of these medications, unfortunately, like, it's fine short term, but if you're using them every day, you have to look at what vitamins you might want to take, or nutritional changes you might want to take in order to address those deficiencies or to prevent the side effects long term.
Yeah, so that's great. So that's when you're taking medications long-term, because listen, we're not telling you to get off meds that you're supposed to be on. And then one last thing for like 1 minute, because like we are running out of time. But so for example, there are things like when women go through fertility, they're going to do IVF. And I know that for some women, it's like, oh my gosh, this is against who I am. And both Dr. Tanya Wild and myself, we both surrendered to the process of IVF and did take drugs. And we're both into like complete natural health. So it does take something, but what we need to do as we go through it is just say, you know what? We look at the why we're doing this and be okay with whatever we're doing, and know that there may likely be some side effects, but typically they're short term.
And it was such a big deal for me to just even to surrender. Like that was such a process. Like I am a naturopathic doctor. Why am I taking fertility medications to make a baby? That took me 3 years to agree to. Like I was stubborn, and a lot of, the delays and loss and such. So yeah, I think that again, it's like recognizing that thank goodness that they exist. 100%. But that you set limitations and decide on, how much you can go through with it and like your backup plans, but also recognizing that they can cause side effects too. But your doctors are really good at preventing that. So, but yes, so it's just like recognizing that sometimes we need both worlds, and that is okay.
That is perfectly okay. All right. So to end up on that high note, let's go through what did you do either this morning, this week to fill your cup?
So I got a paraffin wax maker, and I've been spawing out my hands to help soothe them and rest them. So I get like this hot wax that I use to
and younger looking hands.
Yes, apparently that too. It's got like a nice little side effect. So I don't think paraffin wax is very good for your endocrine system because it's got like the scents and stuff. But I looked it up, and then a physiotherapist recommended it, and I was like, you know what, I'm going to do it. And it's very soothing, and it takes time, and you have to heat it up, and you have to sit there with it. And it seems a little bit selfish because you're spending this time, but then you're like, no, this is me time, and I just get to relax. So
love it.
Mm-hmm.
Yeah.
Because you're literally incapable of doing anything with these, like this paraffin wax on your hands and mittens on. So
these mittens. Love it.
It's very beautiful.
So I'm going to bring it back to me. And, I just feel that we don't get enough nature. And gosh, like this morning when I went out, like I love normally popping on my little earbuds and listening to an audiobook. I'm listening to a great book, but that's a whole other topic. And when I turn it off, now I actually make the point of turning it off in mid-walk because I want to hear the sights and sounds and like really be present with the natural environment. And it's so lovely. I'm like, oh my gosh, the sky is blue. Oh, listen to the birds. And I can hear the rustling of the leaves and just all that, right? Filling my little soul. And I'm like, oh my gosh, I need to do that every time I go out. And I forget that. So I love that.
You are engaging in the 5 senses.
Yes. And we're going to talk about that next time.
That's right.
Awesome. If you love this, please go ahead and share with everyone you know, and check back all of our other awesome podcasts. And it's all for you and in your life, and it's relevant for every aspect of your life. So can't wait to see you guys again real soon.